Hello, I'm Dr. Tara Deliberto, creator of Integrative Modalities Therapy, or IMT for eating disorders, and the author of Treating Eating Disorders in Adolescents, along with Dr. Dina Hirsch. This is IMT Training Video 2, and the topic is the general components of IMT. So there are the published materials and also the content of what is written in those published materials. So let's start with the published materials. There are two sets of IMT works. The first in the set is the Clinician's Manual, Treating Eating Disorders in Adolescents. And this book is only for mental health professionals providing treatment to people with eating disorders. The second is a set of PDFs. There are 6 of them, and a 7th for clinicians only. And these 6 PDFs comprise the client resource book, or the patient and family resource book. So these 6 PDFs represent the 6 components of IMT that are spread across the 3 modalities of IMT, which are individual, group, and family treatment. So if you're interested in getting those PDFs, you can go to the New Harbinger website. The URL is provided below. And if you go to that website, you can hit free accessories and it will take you to a page with the 7 PDFs. If you are a patient or a carer and you'd like access to those PDFs, the first 6 ones listed, those are for you. And let's get into the content. So again, there are 3 modalities in Integrative Modalities Therapy: individual, group, and family. And within each of those modalities, there are 2 sub-modules, we'll call them, and those modules have different content. So in the individual therapy modality, there are 2 modules called regular and appetitive eating, or RAE, and BAE, body acceptance and exposure. So in the regular and appetitive eating module, the focus is on establishing regular eating, which is eating 3 meals and 2 snacks regularly throughout the day, and also appetitive eating. So paying attention to one's own bodily cues of hunger and fullness, and learning to eat with those hunger and fullness cues as guidelines. So in addition to RAE in the individual modality, there's BAE, body acceptance and exposure. So the focus of BAE is on accepting one's body through tolerating all of the negative internal experiences, such as emotions like anxiety, or physical sensations like proprioceptively feeling fat or feeling bigger in one's skin. And through tolerating those negative emotions, coming to accept one's body, and also to foster acceptance and also tolerance, we use exposure therapy as a technique. We use both in vivo and imaginal exposure to foster tolerance of negative emotions such as anxiety, guilt, disgust, shame, etc. around one's body. So that is the individual modality, again, with the 2 modules of RAE and BAE. Then there's the second modality of group therapy. And within the modality of group therapy, there are 2 modules. There's the Mindfulness and Acceptance group, or the MAC group, as we call it for short, and the CBT group, Cognitive Behavioral Therapy group. And the MAC module is used first to treat anorexia nervosa, but it doesn't need to be used in any particular order to treat other eating disorders within the group modality. We'll get into how to use all these modalities and modules for each disorder in another video. But for now, the MAC content focuses on fostering mindfulness and tolerance, and also acceptance of whatever needs accepting. So in many cases, it's treatment. Treatment is really hard to accept, which isn't necessarily the case for other sorts of disorders, but certainly for eating disorders, having to eat, having to potentially gain weight, having to eat a variety of foods, a larger quantity of foods than one is accustomed to, these kinds of requirements for treatment are quite difficult to accept. So the MAC handouts are really focused on targeting those third wave kinds of interventions. Then there's the CBT module within the group modality. And the CBT module focuses on what you would expect: negative automatic thoughts, thought records, behavioral activation, relapse prevention, all of the standard CBT types of interventions. And for people with anorexia nervosa, I'll just kind of cut ahead on this, we use CBT second because when the brain is in a starved state, when a body is underweight, then getting into the content of thoughts and learning to think in a more flexible way rather than in a black and white way is very, very difficult to do with a compromised brain. So we wait until weight restoration to employ the CBT module for people with AN. Again, we'll get into it in another video, but I just thought it might be interesting to mention here as well. So finally, we have the family modality, and there are two modules, again, sensing and pattern, within the family modality. And those two modules are Family Stage 1 and Family Stage 2. In Family Stage 1, when appropriate, and we'll give you guidelines in yet another video on how to figure out who belongs in the family modality and with which module and how strongly to implement these interventions. That's, again, a whole other topic. But when family modality stage 1 is used, the interventions are aimed at empowering caregivers to support their child or loved one with an eating disorder in a very practical way, very akin to family-based treatment, or FBT if you're familiar with that. And the idea is that carers, such as parents, guardians, step-parents, etc., are to prepare, serve, and monitor food and meals. So those interventions also within the IMT framework are what we call behaviorified. So FBT, a wonderful treatment, amazing. We love it. We're big fans, always have been. FBT is an atheoretical model. Basically, what that means is that FBT says that they're not coming from any particular framework, but that to treat eating disorders, particularly anorexia nervosa, in adolescents, these are the things that a person should do. So what we did as behavior therapists, integrative behavior therapists, we looked at FBT and thought, okay, well, where can we make sure that reinforcement principles are being employed, and how can we make the treatment more concrete for parents, this kind of thing. So within stage 1, we have a bunch of handouts for carers and a few for patients, but mostly for carers, on how to implement a treatment at home for their loved ones with an eating disorder. Okay, stage 2. So stage 2 family is embarked on once a patient has either been weight restored, meaning they were underweight with a diagnosis of anorexia nervosa, and they now have a body that is not in the underweight range, and their lab work and everything associated medically with the eating disorder is stable. So in addition to physically being well, the patient is psychologically well enough to try to fight the eating disorder on their own without all of the outside reinforcement and intervention. So in IMT terms, this means that the person acknowledges that they have an eating disorder, so their eating disorder is a self-acknowledged one, and the patient is expressing a degree of desire to recover from the eating disorder and is willing to try behaviors on their own that are in line with recovery. So stage 2 is embarked on when a patient has reached that level, and the interventions in stage 2 for carers are aimed at scaling back on all of the infrastructure that was incorporated into the first stage of treatment. And there's also reinforcement principles and all sorts of integrative stuff that is in that module within the modality of family therapy. And that's basically it. So to recap, IMT has 2 published resources. 1, the Clinician's Manual, Treating Eating Disorders in Adolescents, and 2, the PDFs available online for free on the New Harbinger website. And then there are the 3 modalities. The individual modality, which is comprised of RAE and BAE, regular and appetitive eating, body acceptance and exposure, and the group modality, which has MAC, Mindfulness and Acceptance, group handouts, and CBT handouts. Then there's the family modality, which is comprised of stage 1 and stage 2. And that's a general overview of IMT. Thanks so much.